And now we have three new petitions on the table concerning women's health problems and questions. Petition 663, 844, and 1104. Yes. I have an information that there are here minimally two petitioners, Jan Spivey and Louis Smith. And a part of the presentation will be also showing of some pictures which are sensitive for everybody, so this is an information for you. So, who is the... Madam, the floor is yours, please.
Thank you very much. In the past decade, we became part of the world's biggest public health scandals, in which more than 100,000 European women and their babies, along with another 500,000 more women and families internationally, have been harmed. In some cases have died, and in many cases have been seriously injured and traumatized by PIP implants, which were manufactured in France by people with no technical qualifications or expertise, using unknown manufacturing techniques, unknown cocktails of contaminated silicone without any kind of oversight. With just 5 minutes, we plan to demonstrate to you how the European Commission's SENIA report and sheer review on PIP implants have been used to justify a policy of inaction in response to a devastating public health crisis which has resulted in the prolonged and unnecessary suffering of enormous numbers of innocent women, many of whom are mothers, some recovering from life-threatening breast cancer, or once healthy women who have been robbed of their health, their well-being, in order that a failed system of regulation can continue to put the commercial interests of manufacturers above patient safety, and which continue to promote and profit from dangerous devices that reach the market with a CE mark without proper testing, oversight, surveillance or monitoring. We are here today against the backdrop of the work of 250 journalists in 80 countries as part of the ICIJ implant investigation, which has exposed the horrors of failed EU regulation and has resulted in major action on breast implants in the past 3 months alone. On behalf of the hundreds of thousands of women exposed to PIP, we ask that you take direct action to retract these reports and demonstrate Europe's clear intention to protect and insist on a high level of security for the safety of women and children in Europe and others relying on the CE mark around the world. The conclusions of the SENIA report, which still stands today, is that there is no convincing medical, toxicological or other data to justify the routine removal of intact PIP implants.
I think it's the top line you pressed, guys.
No, she told me this one. Oh, hang on. What's going on?
We're having problems.
Oh. Sorry. Can you start me on the...
I don't know what it doesn't work.
Oh.
Okay, I'm going to change this. Do you want to come with me?
Okay, thank you. There is currently no convincing medical, toxicological or other data to justify the routine removal of intact PIP implants. The Senior Science Committee was originally set up in 2012, involved 7 men and 2 women, and 3 men, not including a medical doctor, were part of the SHEAR review in 2006. I'm showing you a PIP rupture, I'm showing you a double rupture, and I'm showing the periprosthetic fluid that's associated with PIP implants. This is a double PIP rupture. This is what we're asking for women to wait for, because if we're not preventatively removing PIP implants, we're expecting them to wait for ruptures. Removing ruptured PIP is a longer, more complex surgery. It carries much higher risks. These are PIP-saturated axillary lymph nodes. Many women with PIP are experiencing this problem. This is a health problem. Fibrous capsules are also linked, and this periprosthetic fluid, which you can see here in the bottom right-hand corner. The silicone is oily, it's free silicone, the implants disintegrate, and there's frequently this periprosthetic fluid associated with the ruptures. Women experience rashes, saturated lymph nodes, and significant ruptures. I'm showing you some PIP swellings, rashes associated with PIP, and saturated lymph nodes. I'm showing you more examples of ruptured, leaking, dangerous PIP implants. You're not going to like this. This is a removal of a PIP implant. These fluids have to be sent away for analysis as a result of breast implant-associated cancer. These are granulomas. These are a result of silicone free in the capsule surrounding the implant. These are linked to PIP breast implants. Please watch. That's why I'm asking you, please watch. I'm going to read to you from a conclusion from an autopsy performed on a woman with PIP breast implants to demonstrate that the longer that women have been exposed to the gel bleeds from silicone breast implants will find silicone in all organs and in nervous tissue in great amounts. In the Senior Committee report, where there's apparently no convincing medical evidence, the ANSM, the French regulatory body, in 16,426 women found that 42% of the implants were ruptured, 42% had gel bleeds, which is leaking silicone, and malfunction was reported in the remaining 16%. Just a reminder, 16,426 women were reported by the ANSM in the Senna report. In the UK, all top doctors called for the removal of every breast implant given to 50,000 women. In Australia, Dr. Tim Cooper commented, "There's a lot of what we call sterile pus surrounding the implant, and the implant has lost its cohesivity. The shell has shattered, and there's quite a lot of inflammation around the breast implant capsule." And he was asked, "Is this a PIP implant as opposed to most other ones?" And the surgeon replied, "Yes." In our survey of patients, we found a minimum rupture rate of at least 53%. That's half of the number of women that have PIP that have experienced ruptures, with large numbers of the remaining women suffering from gel bleeds. The European Commission have established a task force, which they say is in the collecting evidence. They continue, and most recently on the 7th of February in 2019, presented at the ANSM hearing saying there is still no evidence of any concerns with implants. At the time of the Senate report, 4 patients with PIP implants were found to have suffered from this type of cancer, and one of the patients had died. This, we were told in the Senate report, was of no statistical relevance. At the time of the Senate report, 3 women had died from BIA-ALCL, 1 in France, 1 in the UK, and 1 in Sweden. These are 2 women whose lives are of no statistical relevance: Edwidge Liganesh in France and Susan Grief from the UK. In our study, in our survey of women with PIP implants, 11 women have reported that they have diagnoses of breast implant cancer, and as many as 5% have received a cancer diagnosis. You'll see that a large number of women have depression, and there are many autoimmune illnesses reported. There are still concerns from women who have breast implants and have been told it's perfectly acceptable to breastfeed. In fact, the Senate report devotes a single paragraph to nursing mothers with, and breastfeeding infants. The UK regulator, the MHRA, conducted an experiment to compare one sample of breast milk from a mother with ruptured PIP implants, compared it to a carton of semi-skimmed supermarket milk to conclude that it is safe to breastfeed infants with ruptured or leaking PIP implants. The data that they referred to in the Senate report, in that single paragraph, is misleading, incorrect, and inaccurate. Sweden undertook tests on explanted PIP implants, i.e. those removed from women's bodies, and immediately ordered the preventative removal of the implants. They made this recommendation because it had been quite clear that the chemical contaminants in PIP could harm babies in the womb. The contaminants found in PIP are known as endocrine disruptor chemicals, and they are known to cause damage to the developing fetus. This is from the Swedish regulator recommending that PIP implants should be removed for preventative purposes. Because I'm running so far over time, I'm just going to skip 2 of the next slides, which show that there is quite a strong lobby to prevent women from accessing help, and by the medical devices lobbies and the chemical lobbies in the EU, but they're available to read. I'm going on now to show the table reproduced in the Senate report, showing the levels of D4, a siloxane silicone found in PIP implants. D4 is classified and labelled accordingly. The pictograms is shown, the health hazard pictograms, which is a human torso with an explosion coming out of the chest, and the wording is GHSO8. The endocrine disruptor effects of D4 is considered to be robust. The evidence is robust. This is the label for D4, causes very serious long-term health effects. And this is GSSO8, which shows that this substance, D4, may cause damage to organs, may damage fertility to the unborn child, may cause cancer, is suspecting of causing cancer, may cause genetic defects, and is suspected of causing genetic defects, amongst others. This again is a table produced by the Swedish regulator showing the findings and illustrating in particular the findings of PIP relating to D4. Again, Sweden recommends all PIP preventative removals. That's Sweden along with France. We were concerned that the European Commission Scientific Committee had overlooked these concerns on the toxicological impact of the contaminants found in PIP. We weren't the only ones. And I will read from the CEO report. The full power of the chemical industry was on display in early 2000s as a gargantuan effect led by the German chemical giant BASF successfully watered down a major reform of over 40 EU chemical laws to regulate harmful chemicals known as the REACH regulation. We contacted DG GROW for confirmation of the toxicity of D4, who pointed out in a letter signed, as you will see, from DG Enterprise, the former head of REACH, Sabine Lecrenier, the former head of DG Sanko, and the head of Unit D3 of DG Enterprise. And I read, lastly, please be aware that Article 1.5 of the CLP regulation states that it does not apply to medical devices, which means that the REACH chemical regulations, protections and safeguards expressly do not extend to women with breast implants or their babies. I show you once again some examples of leaking and ruptured PIP implants. We submitted over 70 relevant full-text, peer-reviewed, published research reports and case studies to the SHEAR review. We were told that there was insufficient evidence to change the findings of the Senate report. We stand here on behalf of hundreds of thousands of women, and we ask you, how much medical, toxicological, and other data do you need? We demand today, and we ask you, Mr. Chairman, please retract the Senate report. That's all I have to say.
Thank you very much.
Apologies for the time. Thank you for your understanding. Thank you.
It was really very impressive. And now I give the floor to the representatives of the European Commission. First to Mr. Eric Hansen, and after that to Paul Iskoy. Please, the floor is yours.
Thank you, Mr. Chair. The concerns expressed by Mrs. Spivey has drawn our highest attention, as in the past, and we would also like to thank Mrs. Spivey and the PIP Action Campaign for the efforts in providing information, and both to us and to the scientific committee, and these have been duly taken into account also in the work of the Commission services as well of the scientific committee. And we are, of course, always interested in receiving new data. The safety of medical devices, including breast implants, is of course a high priority for the Commission. And following the discovery of the PIP fraud, which was a criminal act by the French manufacturer to put these devices on the market, we have taken numerous actions and initiatives aiming at reinforcing the controls of medical devices, and also taking this fraud into account in the revision of the legal framework that has been discussed extensively also here in the Parliament, and where we have the new legislations on medical devices and in vitro diagnostic medical devices adopted in 2017 and becoming applicable in 2020 and 2022 respectively. You will notice or be aware that there are a number of measures or a number of improvements in these regulations that are aiming at strengthening the control of high-risk devices. There will, for instance, be a new pre-market scrutiny mechanism with the involvement of an EU-level expert panel that will undertake additional controls on the top of the controls always undertaken for high-risk devices by notified bodies. Also, we are strengthening the requirements on the notified bodies with regard to their competence and working methods. We are also including in the legislation, in the scope of the legislation, some devices without a medical purpose which present the same characteristics and analogous as medical devices. We introduce a new risk classification for in vitro diagnostic medical devices. There will be better transparency through the new UDAMED database, an implant card introduced, and reinforcement of the rules on clinical evidence, including coordinated procedures for this. Also, there are more requirements relating to the member states' market surveillance and the requirements on manufacturers and an improved coordination on EU level. Of course, all these measures also are aimed at preventing as far as possible fraudulent actions such as the case of the PIP breast implants. Although, of course, there is no guarantee even in the future that fraudulent actions can take place. When it comes to the work of the scientific committees on the PIP case, indeed, as mentioned by Mrs. Spivey, there have been several opinions delivered by the scientific committee on health, environmental and emerging risks, that was known formerly as SCENIR. The first one was delivered in 2014. There was the first one already in 2012. We had one in 2014, and then we have also a later one that also deals with other aspects than the PIP implants. And the 2004 opinion concluded that there is currently no convincing medical, toxicological or other data to justify routine removal of intact PIP implants. The committee has since then also evaluated whether there are new sufficient scientific information available to warrant an update of this opinion, and the answer to this was negative. Of course, the scientific committees are carrying out their evaluations and they're delivering their opinions independently. It consists of the best independent experts available, and then the opinions of the scientific committees are taken into account by the Commission and the member states when it comes to deciding on which measures that can be taken. When it comes then to the issues relating to the actions taken on national level when it comes to removal of breast implants, these are decisions falling under Article 168 of the treaty, meaning that it is the member state that has the power to decide whether they wish to take more systematic actions to do this, or if they want to handle it in a different way. So the opinion of the scientific committee can be one factor to be taken into account by the member state, but certainly there are also other information and other factors that the member states would normally make use of for taking this decision. And as explained by Mrs. Spivey, member states have indeed not acted, all of them, in the same way in this respect. So we can see some divergences in the member states on the actions that have been undertaken. So I will stop there, and I'll give the floor to Mr. Piscoy to add any additional comments, if any.
Thank you. I don't think I have a lot to add. Maybe one clarification and one element of novelty. We we are in contact with the esteemed petitioner from June 2012, and we tried over time to clear and to explain all the matters that have been presented today. Also, for the last scientific opinion of the committee, the studies that were mentioned were submitted and were assessed by the committee itself. As a matter of fact, the text of the opinion contains at the end an annex which lists all the data submitted, not only from PIP Action Campaign, but all stakeholders, and it explains what studies were accepted and assessed and what studies were rejected and why. An element of novelty, we are aware that there is a new emerging risk apparently linked to breast implants, which is called anaplastic large cell lymphoma, and we as Commission are considering at the moment to give a mandate to the same scientific committee to see if indeed there is a proven causal relationship and to try to assess what is the cause of this disease, which we must underline. It's a very rare disease, and this makes it very difficult to assess it. Between PIP case, which was again a fraud, it was a criminal activity that is very difficult to control, and the anaplastic large cell lymphoma, there is not necessarily a direct connection. There are two items which are being dealt with separately. Thank you.
Thank you very much. This is now a time for my distinguished colleagues, members of the European Parliament. Madam colleague, please. Mrs. Center, please.
Gracias, presidente. Bueno, en primer lugar, quisiera agradecer a la peticionaria y también a las otras dos peticionarias que hoy no están aquí, Françoise y Marisol, por traer esta realidad que viven muchos miles de mujeres en la Unión Europea. Me he quedado también, y quiero resaltarlo, que las peticionarias señalan que es un problema que trasciende a los implantes PIP y que hay otro tipo de implantes que generan problemas de salud también a otras mujeres. Me gustaría insistir en la importancia del consentimiento informado a todas las pacientes, así como el derecho debido a toda la información relativa a riesgos, trazabilidad de prótesis mamarias y alternativas disponibles. Me parece también fundamental que las enfermedades derivadas de los implantes mamarios sean valoradas y reconocidas por equipos médicos pluridisciplinarios con la finalidad de poder organizar el seguimiento de las mujeres enfermas, así como su cobertura y asistencia médica gratuita. También me gustaría en este punto comentar, después de haber escuchado a la Comisión, que las mujeres somos mucho más que estadísticas y me pregunto, después de haber visto la presentación que vimos, qué más tiene que pasar para que se tomen en serio estos problemas que afectan a la salud de las mujeres. Yo no entiendo cómo permanentemente, tras escándalos provocados por los fabricantes de productos médicos, siempre se nos dice lo mismo. Nunca hay datos suficientes. Y esto me lleva a preguntarme cuánto vale para la Comisión, cuánto vale para los reguladores la vida de las mujeres, cuánto vale nuestra salud. Siempre recibimos las mismas noticias. Me parece fundamental que actúen y que actúen ya. Y en este sentido quería comentar también la resolución del Parlamento Europeo que ha sido promovida por mi compañera Ángela Vallina, que se disculpa por no poder estar hoy aquí, y a iniciativa de nuestro grupo, del Grupo de la Izquierda Unitaria Europea, Izquierda Verde Nórdica, en la Comisión de Derechos de la Mujer e Igualdad de Género, que se aprobó, como digo, la resolución de 13 de febrero sobre desafíos políticos y estrategias contra los tipos de cáncer que afectan a las mujeres. Y ahí se dice textualmente que varios informes han establecido un vínculo directo entre el uso de implantes de silicona y el linfoma anaplástico de grandes células, un tipo poco frecuente de linfoma no Hodgkin, que ha provocado como mínimo 14 muertes entre los más de 409 casos registrados. Se dice también en esta resolución, se insta a la Comisión y a los Estados miembros a que se haga una evaluación urgente y en profundidad de los riesgos asociados a estos implantes, teniendo en cuenta en particular los casos de cáncer y en especial del linfoma anaplástico de células grandes en mujeres. Y se solicita que se cree una comisión de investigación que analice el impacto de los implantes de silicona en la salud de las mujeres. También, por todo esto que hemos estado comentando, me gustaría hacer las siguientes propuestas. Que las peticiones queden abiertas para realizar un seguimiento y solicitar, por ejemplo, un informe a doctores e investigadores especialistas en la materia, como, por ejemplo, a los profesores que citan las peticionarias, reiterar a la Presidencia del Parlamento Europeo que en la próxima legislatura se tenga en cuenta el mandato de la resolución del 13 de febrero y se solicite una comisión de investigación y que esta comisión reenvíe peticiones a la Comisión de Medio Ambiente, Salud Pública y Seguridad Alimentaria, así como a la Comisión de Mercado Interior y Protección de Consumidores, para que realicen una opinión. Que recomendemos a los Estados miembros la realización de estudios epidemiológicos en mujeres portadoras o antiguas portadoras de implantes de mama y, sobre todo, instar a la Comisión Europea a que no espere más, que no siga con esta pasividad y que promueva las medidas complementarias necesarias a nivel europeo y que lo haga ya. Muchísimas gracias.
Thank you, Madam colleague. Anybody else? If it is not the case, I would like to form the decision. We keep open the petition. Secondly, we send the petitions to our new colleagues in the new parliament, to the NV. We sent already all 3 petitions to the NV, but we only this February, and we have no reply from their side, so we repeat it. And thirdly, on the basis of the today's new information and on the basis of the discussion, we ask European Commission for a written form of update of their position in the horizon of few months. Madam Petitioner, you have a right now for last presentation for 2 minutes, please, if you wish.
We are here today against the backdrop of the work of 250 journalists in 80 countries as part of the International Consortium of Investigative Journalists, Implant Files Investigations, which has exposed the horrors of failed EU regulation and has resulted in major action on breast implants in the last 3 months alone. The world's largest manufacturer of breast implants, Allergan, was refused a CE mark in late 2018 after failing to provide adequate evidence of long-term safety and rising numbers of breast implant cancer linked to their BioCell brand. The FDA has issued 2 warning letters to 2 of its approved breast implant manufacturers, Centra and Mentor, for failure to comply with the long-term evidence requirements of their pre-market approvals licensing in the USA. The French regulator, the ANSM, announced a ban on 7 brands of textured and polyurethane implants 5 days ago, along with Canada.
Madam, excuse me, please, a little bit slowly, because the translation is a little bit problem. A little bit slowly, please.
Sorry. The French regulator, the ANSM, announced a ban on 7 brands of textured and polyurethane implants 5 days ago, along with Canada, possibly the Netherlands, as well as Saudi Arabia. Implant manufacturers are allowed to keep the composition of their implants secret, but according to French experts appointed to the French regulator, manufacturers have been unable to provide significant evidence their products do not represent a significant risk of harm. In 2016, French experts found inadequate evidence of biocompatibility, raised concerns over carcinogenicity, immunogenicity, teratogenicity, acute systemic toxicity, specific organ toxicity, as well as reproductive and developmental toxicity in CE-approved implants. We are here today to demonstrate that the conclusions of the self-referenced SENE report and SHEAR review have resulted in obstructing women and babies exposed to PIP and other implants from accessing the correct diagnostics, treatment algorithms, help, support, information and advice, histologies, biopsies, surgery, aftercare, monitoring, research and follow-up. As a consequence of our combined efforts here today, we hope that within the next few weeks, the dangerous and unscientific SENE report on PIP implants will be retracted and our further complaints against the Commission investigated. With many thanks indeed for your time today.
Thank you very much, also, Madam. The decision was already made. Now I